People often say they had a heart attack when someone collapses, but how do you know it wasn't a cardiac arrest? And what is the difference? One's a plumbing problem, the other is an electrical issue. Let's check out the difference. So a heart attack medically is known as a myocardial infarction, and the issue here is there's a blockage in the blood vessel to the heart, which we call the coronary vessels. So in the coronary vessels, usually what happens is atherosclerosis, or a plaque, starts to form, and then usually on top we start to see a blood clot. This stops blood getting past that blockage. That means no blood gets downstream, and a part of the heart starts to die. As this is happening, the person will experience symptoms such as chest pain, nausea, and sweating. Treatment here is what we call a PCI, or a percutaneous intervention. This is where the doctor will put some equipment up a blood vessel, usually from the leg. It will go all the way to the blockage, and it will try to reopen it with a balloon or a stent. If this doesn't work, they will use a CABG, which is a coronary artery bypass graft, which means they put a blood vessel to bypass the blockage. Now compare that to a cardiac arrest. A cardiac arrest is an electrical problem. So the heart is a muscle pump. It beats atria, ventricles. This allows blood to go to the body and supply oxygen and nutrients. This is coordinated by electricity, which we can measure on the ECG. We see a P wave, a QRS, and a T wave. This allows the atria, ventricles to contract in a smooth and effective way. But in a cardiac arrest, the electrical activity goes chaotic and haywire. So the ventricles can beat very, very, very fast, not allowing the heart to fill with blood. That's called ventricular tachycardia. No blood to the body runs out of blood. Or it fibrillates like a bag of worms, which we call ventricular fibrillation, no blood to the body. Or it stops completely, asystole, no blood to the body. As this is happening, the symptoms would be seen, no pulse, the person collapses, they stop breathing, they'll eventually die. The treatment here is to apply CPR, or in certain cases, defibrillation. But in any case, even though heart attack and cardiac arrest are different in cause, different in treatment, they are both medical emergencies, and getting quick attention will save lives.